we've come a long way with weight loss surgery and the techniques and fine-tuning the details to know what specific elements of the procedures are important to get your weight down and keep it down, and most importantly, get you the health benefits of losing the weight. Right now, we have patients who've had surgery 20 years ago, and they did well, and maybe they've had some weight regain or contracted their other diabetes or high blood pressure, high cholesterol again. And the truth of the matter is obesity is the disease like any disease, and it can go into remission, it can come back, it can reoccur. And so for these patients, obviously their obesity has reoccurred. And the good news is there are still some things we can do to help. There's always the medical management. We always start with getting you back on your nutrition, your exercise program, figuring out what changes have you made on your program to get you back on our program, which is for successful weight loss. But on top of that, we also have a lot of surgical interventions that have proven really good over time. Generally not as good as the primary or first procedure, but for someone who's struggling, we can generally get you back into a healthier state with a revision. And revision means we're taking the surgery you've already had and changing the anatomy to make it a little bit more effective. Sometimes you've had a problem with maybe your gastric bypass, where maybe the pouch has grown back to the stomach. We can fix that. Sometimes you need a change in the length of your intestine that we're bypassing, so we can change that. You may have had a sleeve and you've done well, but now you've had some weight gain, and as the sleeve is part of the duodenal switch, which is a sleeve and an intestinal bypass. We can finish that procedure. Step 2 will be connecting the intestines back up to the stomach. So there are a lot of things we can do that can help your weight loss continue or resume, and more importantly, get your health problems under control. So just because you had one procedure, we always like to say, you didn't fail, the procedure failed you. And most of the time, we can find something technically wrong with the procedure, whether your pouch stretched or whether your intestines changed, and we can fix that with another surgery, get you back on the right program, and get you successful losing weight again. A lot of groups will do the primary surgery but not want to do the revisions later for people who've had surgery a while back. And the truth is, we enjoy those procedures because, again, we have 2 surgeons. We're operating on the patient, a little bit trickier anatomy, but we're able to get through it and get some really great results. You know, I wouldn't really trust people who only did a few procedures a year or who didn't have a lot of good surgical backup like we do, who don't have the experience. That's the biggest thing that it comes down to, is we've got the experience, thousands and thousands of procedures that we've done. We've seen every type of patient, patients on blood thinners, patients with heart disease, kidney disease, patients with BMIs over 70, patients with BMIs around 30. We've seen them all, and we've handled them really well. And I think that because of our experience, you're going to get the best results through our program.